Tonight's 9 p.m. Extra, a new tool that may help take the pain out of going to the dentist. And as you're about to see, water is the key.
In the past few years, I didn't go because I'm never really fond of going to the dentist, It's painful. A lot of shots, all the lidocaine, those injections are really painful. So I just didn't go for about 2-3 years.
Well, after getting the courage to go back to the dentist, Luan Nguyen found it less painful when a new tool called the Waterlase MD was used.
There's no downtime, no food restriction, and it could be done really as soon as possible, and I actually got it done 3 days before the wedding.
That's right. 3 days before her wedding last November, Luan had her gummy smile fixed. In a procedure that could be painful and require a lot of downtime, that wasn't the case.
She walked out of the office and she's like, nothing, pain-free. 3 days later, got married. No problems whatsoever.
Dr. Bicky Tran at Simply Dentistry in Scottsdale uses the Waterlase MD in her practice. It's a device that uses laser energy combined with water.
Well, how I like to relate it to is the same as putting a Band-Aid with Neosporin over an open wound with a laser. It decontaminates the area again, so the healing time is a lot quicker. And the way it removes tissue, it's not the traditional cutting method. So it's breaking down the tissue very, very slowly, and it basically coagulates the area, so you're not having all this bleeding, you don't need sutures.
Dr. Tran says the Waterlase MD also eliminates the use of shots and drills. It's not just for extensive procedures like Luan's. It can be used to fix small cavities and even do root canals.
Not only does it cut through smaller cavities and tissue, but it can also decontaminate my working field. So if I'm doing a root canal, basically what we're essentially doing is removing the bacteria in the canal of a tooth. But with the laser, I can also kill all the bacteria without having to use antibiotics.
Luan couldn't believe how she felt after it was done.
There was really no bleeding, no pain. I went back to my usual diet. And I brushed my teeth, I flossed, usual routine. I didn't have any problem at all.
Now the Waterlase MD can't be used for every procedure, but Dr. Tran says no matter what fear you have when it comes to the dentist, there's always a light at the end of the tunnel.
It's okay to come to the dentist, and it's not what it used to be, and whatever your fears are, everyone's going to be different. Whether it's the noise, it's the shots themselves, there's always a solution.
And as always, check with your own dentist about what's best for you.